According to research, mental health disorders are a leading cause of health disabilities in 10 to 24 years olds in Zambia, and a recent report released in Lusaka reveals that the country has experienced increased number of children committing suicide because of the same. But what is mental health?
Mental health is basically, I'll define it in the simplest way. Mental health is brain health, which involves how you think, how you feel, and how you respond to situations. So if you are able to respond to situations in a positive way, that means you have a mental health. Then there's a difference between mental health and a mental illness. So a mental illness is when you are not able to respond to situations in a positive way, but in a negative way.
Mental health, I feel it's one of the fields that has been given less attention. Why am I saying so? Because I feel mental health borders on everything about a human being. My understanding is that it has to do with the emotional well-being of somebody. It has to do with the psychological well-being of somebody. It has to do with the social well-being of somebody. So if somebody has issues in terms of mental health, it means that even the other areas will be affected. So it's everything about somebody's well-being.
In an African setup, people living with mental illnesses are often stigmatized, shunned, and excluded from society because traditionally, many Africans believe mental illnesses are for the weak in the society. Regardless, an estimated 100 million people in Africa suffer from clinical depression, including 66 million women.
Unlike the Western culture, mostly in Africa, we are in this environment where mostly children are not allowed to open up. Okay? When stuffs are happening, when they're going through problems, even when they are being abused, there's this notion to say it's a taboo to open up, to say that this uncle or this father is abusing me. So from the cultural point of view, I know it's not easy to bring a change which has to do with culture, because culture is a way of life. People have been existing just like that. So there's really a need to do a lot of sensitizations to encourage people to say it's fine to open up.
Worldwide, developed and developing countries are facing the double burden of prevailing suicide rates due to mental health related problems. Suicide, described as the act of intentionally causing one's own death, has been attributed to various factors, among them being mental health disorders such as depression.
The reason why I'm so very much passionate about mental health is the fact that I went through depression and anxiety myself for the past 12 years. I struggled so much with depression without knowing what I was going through, without knowing that I was struggling with depression and mental health. This is why nowadays I just stand up and just want to reach out into schools and reach out in colleges, universities, just to talk about mental health. Because I was once in school, I was very young by that time. I never had an idea. I never knew where to go to seek for help. I never knew that I was not educated enough towards mental health.
Growing up with a medical condition, Duncan passed through a lot of bullying, both at home and school.
I struggled with depression and anxiety for the past 12 years, and because of that I reached at a point where I said enough is enough. I think I feel this time around I'm just going to end my life. So what triggered was my life situation. Coming from a broken home where my dad and mom separated when I was a kid, when I was very young, where I went through so much trying to, it's not easy at that point. And also I also struggled with a chronic migraine headache. I don't know if you know what pain is. I don't know if you are able to define pain, but mine, it was just very painful, a chronic migraine headache that I struggled with. And from that, it resulted me having like a lot of sores on my lips. So whenever I go to school, whenever I go at home, my friends would laugh at me and they would mock me, like they would tell me some things like "Fimilo Mungu Mama Kachaso." You know, that made me have low self-esteem, and that made me feel like there is nothing for me, and why me? You know, I'm one person that has shouted at God so much, like, God, you do not exist, because if you do, why do you allow me to go through so much pain? Because the chronic migraine headache was just very painful, and adding up to where I come from, a broken home, where having a lot of family issues at home, and also just going through that bullying at school where my friends would mock me, they would bully me, call me all kind of names. That made me feel like there is nothing for me. That made me feel like there's no reason for me to continue living. And adding up to what the doctor told me, because the chronic migraine headache just affected my eyes and everything, the doctors told me that there's a possibility that my eyes would go blind. And also there was a possibility that, you know, it's like they never had solution for the illness that I was facing. So I felt before my eyes go blind, I should just end my life in advance.
Being a man, Duncan's situation got even worse as more people thought of him as a weak man, and the bullying continued.
The fact that I was going through so much as a male child, whenever I tried to reach out to talk to people, the things that I was going through, I was being told that you are a man and you just have to be strong. So it's like they didn't understand what I was going through. Of course I'm a man, but it was just very painful. It was just so painful to me. So to the people I could reach out to tell them that this is what I'm facing. Sometimes whenever the chronic migraine headache starts, I used to cry so much because it was just very painful. I don't know if you know what pain is, but it was so painful. It would affect my eyes, the veins and everything. I could just start crying like a baby. And you find people just come, no, you're a man, stop crying, you're a man, just calm down. But they didn't understand what I was going through, and just the things I was going through via family and at school, the bullying and everything. Whenever I reach out to people to call for help and just to cry out for help, they'll tell me that you are a man, you just have to be strong. You know, you need to be more stronger. But they didn't know what was going on inside of me. So that's one of the stigmas that I went through.
Duncan's realization of himself and how he was created helped him overcome his depression and anxiety.
Some of the things that started changing in my life were that I started accepting what I could not change about my life, and I had to change what I could change about myself. So I saw myself, I said, okay, I have sores all over my lips. That's me, and I can't change that. I saw myself that, okay, this is family issue that I have at hand. I cannot change it. I accepted it the way it was. I started loving myself, and I started accepting myself. And I started walking upright once again, even when people would speak. But there was that inner voice inside of me that told me that one day things are going to get better, and it doesn't matter what I was facing that day. There is the future. You know, I started imagining myself in future than what I was going through at that particular moment. I remember the times I was attempting suicide. None of my family members knew. Some of my friends knew, but not my family members. And the time that I survived the attempt of suicide, everything changed. I started coming into open to what I was experiencing. That's when my family started knowing, and also just trying to learn from what I've been talking about.
Suicide is indeed a complex issue, encompassing philosophical, ethical, legal, and practical dilemmas. Seeking help is a sign of strength and not a weakness. And it is important to remember that treatment is effective because people who get appropriate care can recover from the mental illness